Do you have high anxiety in social situations? Do you worry that you're going to embarrass yourself or that other people are going to judge you negatively? And this is causing big problems in your life. If that's the case, watch this video to learn more about social anxiety disorder. My name is Andrew Dutcher, and this is my channel, Mental Wealth. I'm training to be a child and adolescent psychiatrist in Alberta, Canada, and I wanted to create a YouTube channel to help educate people, and mainly youth, about mental health, mental illness, and treatment options. In this video today, I'm going to be talking about what social anxiety disorder is, or SAD, how common it is, what the clinical features are, and what causes social anxiety disorder. And if you stick around to the end, I'm going to be sharing with you an evidence-based CBT strategy used to help deal with social anxiety, and as always, an awesome joke at the end. So, social anxiety disorder is defined in the DSM-5 as having marked fear or anxiety about one or more social situation, where the person's actually exposed to the scrutiny or the judgment of other people, potentially. Now, those anxieties can also be from being observed by other people or performing in front of other people. And what the main fear or anxiety is in those situations is that they're going to act in a way or show signs of anxiety that might lead them to be negatively evaluated by other people. This anxiety can present in many ways, but the most common ways are that they worry about embarrassing themselves or humiliating themselves in front of other people. But it could also be that they worry about offending other people by the way that they're acting or their anxiety, and that they would get eventually rejected by those other people as well. Now, some other features about social anxiety disorder are that the social situations almost always provoke that same anxiety or fear response in the person. It also is the case that the anxiety and those responses to anxiety have been present for at least 6 months. The social situations that cause the person to feel anxious are either actively avoided, so they're not going anywhere near that thing that's making them so anxious, or when they do go in those situations, maybe being forced to go in that situation, they feel extremely uncomfortable and want to get out of that situation. Some last features about social anxiety disorder are that the fear or anxiety in that situation is out of proportion to the actual danger in that situation. So it's not really an anxiety disorder if there's actual danger in that situation that you're worried about experiencing. But it's also the case with social anxiety disorder that it has to cause clinically significant distress. So it's really distressing for you and you just can't tolerate it. Or it's causing impairments in your function, like you're missing out on class presentations, or you're not going to work or school, or you're not leaving the home. And these can be very problematic. And the last thing about social anxiety disorder is that you want to rule out other causes of anxiety, where things like alcohol or cannabis may be causing anxiety in someone and leading to that social anxiety that they're experiencing. But you also want to rule out other medications, other medical conditions, or other mental disorders like depression or other anxiety disorders. And that is how you would come to a diagnosis of social anxiety disorder. Now, some people have a very specific type of social anxiety disorder where they don't really struggle with social situations in general, but when they have to get up in front of a bunch of other people and do a performance, then they really do struggle with the anxiety that they might experience in that situation. And that would be considered the performance type of social anxiety disorder. Social anxiety in general is not a disorder, and lots of people experience social anxiety at some point in their life. Social anxiety can actually be developmentally appropriate, or appropriate for a certain stage that you're going through in your life, such as in your adolescence, in your teen years, where the changing environment and learning all of these new social skills can actually be quite troublesome and frustrating for a lot of people. And so they struggle with anxiety in those situations until those skills get a little bit better. The anxiety can also happen at different stages in people's lives. When there's a transition to a new stage, like maybe retirement, and people struggle with adapting to new social spheres that they're going to be part of. Social anxiety starts to become a disorder when it causes the person to start to miss out on certain events that they really wanted to go to, or that they were required to go to, like school or work. Or it causes clinically significant distress, where the person's really struggling emotionally to be in that situation. Now, the person may want to avoid performing in public, or this could even be things like eating or drinking in front of other people. They also may worry about writing in front of other people or pointing at things or people, as they might worry they might offend other people. If someone worries about sweating in public, they may avoid certain things like shaking other people's hands or eating spicy food in public. It could also present as shy bladder syndrome, where someone struggles with urinating in public restrooms because of that fear of being judged or having other people around. People with social anxiety disorder will sometimes worry for weeks on end prior to a social event or a big performance coming up, really building up the event in their mind as this really scary thing where they're going to be negatively judged or evaluated by other people, and eventually make it such a big thing that they're going to eventually avoid it. People with social anxiety disorder may struggle with being assertive in social situations, or be excessively submissive and just agree with whatever other people say, even if it's not in their best interest. In other situations, it might be the opposite, where the person tries to highly control the conversation that they're having with someone because they're so socially anxious about it going another way that they're not expecting it to. However, that is a less common way that social anxiety disorder does present. People with social anxiety disorder may have an overly rigid body posture. They may struggle with making eye contact with other people, and they may speak in an overly quiet voice that makes it hard for the others to hear them. Social anxiety disorder can cause lots of problems in people's lives, where they miss out on all sorts of social opportunities to meet friends and new people. They may also lose out on job opportunities that they were too afraid to go for because of that social anxiety. And they may fail classes or tests because of the anxiety associated with either performance or being around other people. It may also cause people to live at home longer when they grow up. And men with social anxiety disorder may delay getting married and starting a family, which can be problematic for them. Lastly, a big problem with social anxiety disorder is that people commonly self-medicate their symptoms, where they're using substances like alcohol or cannabis to help reduce anxiety in those social situations so that they can help talk to other people or engage with other people. But this becomes a big problem when the person continues to use substances and can actually get addicted to those substances as well. If there was a hallmark symptom for social anxiety disorder, and if we were to talk about physical symptom that does come up, blushing would be considered a hallmark symptom of social anxiety disorder. Now I'm going to talk about how common social anxiety disorder is, because it is quite common as a condition for a lot of people. In fact, 3 to 13% of people experience social anxiety disorder in their lifetime. And this number is only overshadowed by 33% of people considering themselves to be more socially anxious than most people. So this is a really common condition, but also a common experience for a lot of people to have as well. Women are more likely to be diagnosed with social anxiety disorder than men, and the peak age of onset is in the teens. However, it can happen anywhere from 5 years old up to 35 years old. Common conditions that come along with social anxiety disorder include things like other anxiety disorders or depression. And another big one that I've already talked about before is substance use disorders or addictions to substances. Now, what causes social anxiety disorder? And so it's complex, as we always kind of talk about, with that biological, psychological, and social factors that contribute to the development of social anxiety disorder. And genetics plays a big part in the development of social anxiety disorder as well, because those who have social anxiety disorder are much more likely to have a first-degree relative that also has social anxiety disorder as well. In fact, they are 3 times more likely to have a family member who has social anxiety disorder as well. From a biological perspective, there are other chemical factors that may contribute to the development of social anxiety disorder, because we know that drugs that affect either the adrenergic system or the adrenaline system, and drugs that affect the serotonin, can also help decrease social anxiety disorder as well. Now, some studies have found that in children with social anxiety disorder, their parents were less caring, more critical, and more overprotective than other kids who didn't have social anxiety disorder. The risk factors for social anxiety disorders are: 1, behavioral inhibition, which I already talked a bit about already. Number 2, genetics, where someone with social anxiety disorder is much more likely to have a first-degree relative with social anxiety disorder as well. And if your parents have it, that's a much higher chance that you might have it as well. 2 other factors are fear of negative evaluation and childhood maltreatment, where someone's experienced abuse as a child, and that although this isn't a causative factor, they are highly linked to one another. So the onset, when people first get diagnosed with social anxiety disorder, is usually in late childhood and early adolescence, from about 8 to 13. It's usually a chronic condition, which lasts for many years. However, those that experience remission from the symptoms of social anxiety disorder tend to do well over time and not have the symptoms come back. And that's it for today's video. We didn't talk about treatment. If you are interested in hearing more about possible treatment options for social anxiety disorder and anxiety disorders in general, I will be doing further videos in the future about treatment. And if you really want to check out some general suggestions for treatment of anxiety disorders, I've got another video that you can watch on YouTube as well, and you can check that out. But now I want to go through the strategy that I wanted to share with you guys about dealing with social anxiety better in an evidence-based and CBT approach to dealing with social anxiety. So you may need a pen and paper for this part, but you can always rewatch the video and watch it over again, and I'll leave some tips and some resources down in the description below to help you with figuring out, developing a plan, and the suggestions that I'm going to make here. Number 1, you're going to develop an exposure plan where you're going to write down from 10 to 20 different items that cause you to feel anxious in certain situations. And you want it to range from low to high anxieties and really intense anxieties that you're going to experience. And you're going to want to rank those from either low to high or 0 to 100 based on how much anxiety they cause you. Number 2, you want to target anxious thoughts. And so on that sheet, you're going to put another column right beside each of the different triggers for anxiety, where you're going to have thoughts that might come up and cause you to feel anxious with each of the triggers that you're going to experience. Number 3, plan to start moderately and resolve to pace yourself. And what this means is that you want to manage the anxiety that you're having throughout this experience, and that you don't want to overwhelm yourself throughout the process so that you give up on the work that you've been doing to try and challenge your anxiety. You want to be doing this work in a graduated fashion, where you're going to be exposing yourself to things that cause you a moderate level of anxiety, and then riding that wave of anxiety until it comes down to a tolerable level, and then allowing your body some time to adjust to that new state of anxiety. Like I said before, you don't want to start too high, because you're going to get way too anxious and you're not going to be able to tolerate it, and then you're going to get out of that situation and it's actually going to intensify the anxiety that you experience in that situation. You also don't want to start too low where the thing that you're exposing yourself isn't causing you really any anxiety at all, because, well, you're not really doing any work at that point. It's just kind of doing nothing. And the last piece is that you want to stick to one task until you master it. So keep on doing that same exposure thing. Say if it's like going to the mall and that really makes you moderately anxious, you keep on going to the mall until you start to feel like you're mastering that and it's not making you as anxious anymore. And you keep on doing that until it gets to that point before you move on to the next thing that you're going to try and work on in terms of your anxiety. Number 4, commit to practice. Practice and more practice. So with this type of work, if you don't do enough of it and not intense enough, this could actually make your anxiety worse. If you're only doing it for 5 to 15 minutes and or it's not enough of the anxiety producing, it's not going to be effective and you're not going to feel like you're getting anything out of it, and then eventually give up on the work. So what you want to do is you want to target that thing that makes you feel moderately anxious and then stick it out for at least 30 minutes each time so that you become adjusted to that level of anxiety and feel like you're able to manage that. Number 5, develop a coping strategy. So have a list of coping skills or strategies that you're going to have on you that is going to help you cope with the anxiety in that situation and help you get through that moment. So this could be things like modify your anxious thinking and observing those anxious thoughts that you're having and trying to correct them with evidence in the environment. Or you could be really mindful and focus on the physical symptoms, even if they are distressing, in that situation to help take your mind off the anxiety from the external situation. You could also do things like focus on your breathing and taking nice deep breaths, because people forget to breathe when they're anxious. And then there's also visualizing mastery, where you're just thinking and imagining to yourself that even though you're anxious in this situation, you're just killing it in this situation and you're really doing well in terms of coping with this anxiety. You can also do things like look for signs of safety in the environment. So challenging some of those anxiety thoughts again and saying that, no, I am safe in this environment. Now, this does come with a caveat, because if you do find that there is a coping skill that really dramatically reduces your anxiety in a situation, then you need to stop using that one. Because I know this sounds kind of bizarre, but with anxiety, what we're trying to do is build up the tolerance to more and more anxiety and those different levels of anxiety. And if we're finding a skill is actually bringing it down really quickly or dramatically, then we're probably using it as an escape from the anxiety and not necessarily as a coping skill to the anxiety. And so you just have to be careful with that distinction between a coping skill and an escape from anxiety. Okay, finally, I know what you've been waiting for. It's finally time for the joke, and so here we go. What did the green grape say to the purple grape? Breathe, man, breathe! Alright, thanks so much for watching, guys. This is the end of the video. I really appreciate you guys sticking it out to the end, and I hope that you've got some value from watching this video. If you did get some value from this video, feel free to give that like button a little tickle, and do the same thing to the subscribe button. So if you guys are interested in watching other videos, I have some other videos on anxiety at this time, and I'll be creating more content on other subjects as well. Feel free to share this video though with people that you think may benefit from this, and I hope that this video and this content can help as many people as possible. My name is Andrew Dutcher, and this is my channel Mental Wealth. Thanks so much for watching. Take care.